The mission of La Clinica is to improve the quality of life of the diverse communities we serve by providing culturally appropriate, high quality, and accessible healthcare for all. The history of La Clinica is very much embodied in the movement of the 60s. A group of students from UC Berkeley who were activists decided to do a class project that involved surveying the community. And in that survey, what they learned from the respondents was that overwhelmingly there was a concern about the lack of health access. Not only are we the medical home to many of the uninsured of the East Bay, in fact, we are the largest community health center in the Bay Area, but also we take pride in the fact that our services are comprehensive. While our principal focus is the delivery of quality health care, one of the responsibilities that we feel we have is a commitment to the economic development and well-being of the communities in which we reside. We take pride in the fact that we are one of the largest nonprofit employers in the Bay Area and the largest employer in the Fruitvale District. The organization has a very strong commitment to hiring from within the community. And part of that has been training people, many of whom have been patients and continue to be patients of the organization.
It was hard not to run into something that had to do with La Clinica, and it was growing. This was the 70s also. As a young Latina woman, it felt like an area that I could become active in a field that I was interested in. Currently, I'm a clinic supervisor, and I wouldn't work anywhere else. We haven't depersonalized our care, and I think that's what really makes us unique.
San Antonio is not only for one ethnicity, San Antonio is for everybody.
When I first came to the clinic, I was blown away. That's exactly the kind of work environment I enjoy. I just, love the diversity, the patient population here, and they need the care.
One day I'm just sitting in the room, and I literally hear 3 languages. There's Tigrinya being spoken, between a patient and a medical assistant. In another room, there's Cantonese speaking. Somebody else is speaking Spanish, and I'm thinking in English. And I'm thinking, this is it. It just can't get any better as far as delivering healthcare.
I tell people that want to retire, want to volunteer here, because I love it so much here because of, one, the diversity, 2, the dedication of not, all the providers and supporting staff.
As a society, we're barely beginning to understand the importance of dental and its contribution to the quality of life for an individual.
We provide comprehensive care. We have all of the specialties represented here through different doctors, whether it be oral surgery, endodontics, which is root canals, periodontics, which is gum disease, treating diseases of the gums. We have an orthodontic clinic. So we're very fortunate because of the proximity of the dental schools and the willingness of people to come and volunteer to help us with these programs.
And I'll show you how to brush your teeth. I'll show you and then you can show me.
We are seeing children as young as 18 months knowing the health education around dental from the very beginning is going to make all the difference in that child's quality of life.
Try and do that for me. And that way you're going to keep your teeth nice and healthy because you have perfect teeth right now.
Over 50% of our patient base are children. And that commitment in pediatrics is demonstrated in immunization rates, well over 97%, and by a staff that cares deeply.
Good job.
But we do over 22,000 patient visits a year in the pediatric site alone here at Transit Village. We're very focused on prevention, but the 2 probably biggest issues in terms of chronic disease are asthma and then pediatric overweight. But certainly in talking to our family medicine colleagues, we know that the consequences of pediatric overweight is all starting in these kids, and we're seeing rates of obesity of over 35%. Given the focus that we have on prevention, we're trying to focus on healthy ways to help the children and their families make changes so that they don't need to be seen in diabetes clinic.
Our commitment in family medicine is to take care of the total needs of the family. And that includes our senior citizens, and it includes our adolescents and our children. Family medicine is able to provide the full gamut of services to that family. We're very proud of our women's clinic and our prenatal program. We are delivering over 60 babies a month just in the Oakland site. One of the things that makes us very strong is our ability to serve these women in multiple languages.
Está bien. La vejiga grande.
And for the patients, they know that they're going to get care here. It's culturally sensitive for them, and that when they come to the hospital, which is a little intimidating for most people, that they're going to have a provider from this clinic who's going to be there too.
So much of our society considers eyesight a luxury. And in fact, when poor people receive health care, the eye is not considered in the quality of life for that person. In our eye clinic, we have the benefit of working with a number of organizations, and some of the services include providing free eyeglasses to many of our children who, without these partnerships, would go without. We have a leadership group from our youth in the community who are very active in telling us what kinds of services they need and want. An integral part of our clinic are the school-based clinics, and each of the school-based clinics has access to comprehensive healthcare services. Services in the schools have resulted in less absent days and in higher grades for the students who have been able to take advantage of the services that we provide to them in their school setting. We're very fortunate that mental health was part of our clinic from the very beginning. I cannot imagine this community without services in a culturally and linguistically sensitive manner.
Imagine people experiencing a number of distressing circumstances, economic, political, social, family. I wrote in one poem, they come to us with their broken hearts, their broken dreams, their broken relationships. And we enter into a therapeutic relationship that has implied hope that they bring, that somehow, some way, working together can begin mending those broken hearts, broken dreams, and broken relationships.
We have a very strong commitment to our children and to our families, and part of that commitment is demonstrated in the work that we've done around prevention.
Preventive medicine is very involved in supporting other programs of La Clinica. For starters, we offer a plethora of classes in diabetes, asthma, and in car seat, birthing education, hypercholesterolemia and hypertension, and the overweight class.
We have a pre-diabetes program in which we're trying to prevent diabetes rather than have to treat it and control it down the road. We actually modeled this program on a study that came out in the year 2000.
It showed that they were able to reduce the incidence of diabetes by 58% if a person lost 7% of their body weight and exercised 150 minutes every week. We now have 498 people identified with prediabetes, and in the 3 years we've only had 12 people convert to diabetes so far. Most of those people who converted had not even taken the lifestyle classes yet.
We have a program set up for diabetics. We have over 200 patients in the program, and the diabetic will have a particular doctor that's their primary care doctor, but they'll also work very closely with a promotora or lay health advisor, and she will call them every week and see how they're doing on the areas of eating well, checking their blood sugar, taking medications, and exercising is a big one. For all of our diabetic patients here at this site, we have them in a registry, and we track a variety of outcome measures in them: cholesterol, weight, blood pressure, the last time they went to get their eyes checked, their teeth checked, the last time they went to the nutritionist, got their feet checked. We use that information to pinpoint problems and make sure our quality of care stays high for diabetic patients.
The organization has a very strong commitment to health education. We understand that the time that a physician spends with a patient is limited by design, and that in the end, self-management, self-empowerment is going to make the difference in terms of the well-being of the person. We have had many patients who have come to us after having received services who feel and have felt empowered by the information, by the support, by the guidance that they have gotten through our health education program.
Bueno, recién acabo de llegar y el servicio fue dental. Primero que más quería yo traer a mis niños porque la verdad que es algo que siempre me interesa saber cómo están en salud bucal.
We're unique in terms of the makeup of our board because of the fact that we ask our individual patients to be directors of La Clinica. This is important to us because our mission is to serve the underserved, and we are asking for their direct input on what we need to be doing to better serve them, and you can't have a better advocate than a patient.
As a funder, it's a no-brainer. It's a fiscally well-run organization. They know what their mission is. They add value in a variety of different conversations. And really, we are much richer as a healthcare delivery system to have La Clinica.
The biggest challenge that we face as an organization is the growing demand for our services. Every year, the number of uninsured continues to grow. Our challenge is to continue to provide high quality of care while maintaining a commitment to our mission in a way that is sensitive to the diversity in our community.
Yo sé bien.